Jessica. I'm a sex worker in Kenya, and I give you permission to use this video. I would like to touch in the life that we as sex workers live and what we experience as mothers. And while during pregnancy, I'm a trained CHV, yes, by the Ministry of Health, but when we go to get data in the community, most of the data that we collect is on issues of general population, but they don't want to touch on issues that face sex workers in the community on maternal child health. This is very sad because most of our fellow sex workers experience violence and during their pregnancy, accessing services in the government facilities and other areas where they can get services, it is hard because most of them lack money, and there's much stigma and discrimination from the community to the hospital facilities. So most of them end up not giving birth well. Some experience miscarriages, and some end up doing some unsafe abortion because of poor and lack of enough support from anyone or counseling during the pregnancies. This has led to unwanted pregnancies, unwanted children, and most of the children end up becoming street children, and also thugs. Some join bad gangs. You cannot blame a sex worker because we have no choice. Nobody cares. None of them even come to us to ask why we're experiencing such problems. Reason being, there's not enough money. So we do sex work by engaging ourselves in taking drugs and alcohol substance because we cannot stand being a sex worker and nobody cares about our lives or our children. Most of us, we believe that we are human as any other person. We deserve to have rights like any other human being, and our children have to be taken as any other person's children. When they go out in the community, they're being discriminated, beaten, harassed. Violence is very much among the sex workers' children in the community. So we feel sad as human being, as a person who is a citizen in a country, and nobody cares what we can do. Even we need support whereby we can have IGAs, income generating activities, whereby we can sustain our lives, sex work, and having something else to support our livelihood, our families, and our children. We are active, we are strong, we can work, we have things to do. We can support even some other activities in the society. We are human beings. We join other communities by working together in the society. So we should be taken equally in the society. We've also been experienced having cervical cancer due to lack of proper medication and the proper ways to do abortion. So we end up having cervical cancer, and we don't have good equipment to check us, and we cannot support ourselves because there's no money after being diagnosed with cancers. So we end up asking for funds. I'm a cancer survivor, yes, and the only people who ended up supporting me, most of them were sex workers themselves. I survived breast cancer. Now I'm 4 years, but we have somebody out there whose voice is not heard, and this is very bad because I'm a sex worker. I need to get services equally. It is very expensive to treat cancer, and we need people who can come out and understand us as sex worker. We suffer a lot, and this is sad. And also our children experience some complications after we've done unsafe abortion. So we need even to have things to stop this, because we want to know before I do abortion, I have to go for test. We need to have the test kits for testing ourselves, and also we understand how we can access the services well without stigma and discrimination, where we can have our clinics to go for test and have safe deliveries in the hospitals.
Thank you.